Hello, this is Christine, physical therapist and creator of Aging with Ability, where my goal is to provide encouraging resources for older adults to improve their health and age well.
Welcome to Fitness Friday, where I talk about all things older adult and fitness, including balance, strength, endurance, types of exercise, and other ideas to encourage you. Today I want to talk to you about snacks, and I'm not talking about the delicious kind that we all enjoy, but I'm talking about exercise snacks. So this may be a term you're not familiar with, but it refers to the concept of short duration of exercise in order to increase your overall exercise participation in a day. So exercise snacks are around 5 minutes long, but really any duration can help you and provide some health benefits compared to sedentary behavior. Maybe you don't have a full 30 minutes or an hour to do a full workout, but exercise snacks can fit into your day, and they're really nice because they don't require a lot of preparation or even gym clothes. So when you think about exercise snacks, I want to tell you about a few of the exercises that a lot of people do as a part of them. So even something simple such as sitting down and standing up from a chair a few times in a row, or doing some seated kicking or knee extensions as we would call them, or doing heel raises. Those are just a couple of examples. And in particular, older adults, these are really beneficial for because it helps to break up sedentary periods, which can be more common as people age. As you get older, your lifestyle changes, your daily routine changes, and sometimes this leads to more sedentary periods. So by breaking them up with the short duration of exercise, it can really have an impact on your overall health. So they're kind of a nice way to add some meaningful exercise without having a big stress about a long period of exercise and what you're going to do for that time period. So I typically recommend these to my patients, especially because I see a lot of people right after surgery or recent illness like pneumonia or something like that. And these help encourage blood flow and, like I said before, break up any long sedentary periods. And also they can build up over time and actually have muscle strength gains and functional mobility changes. So for context and to kind of talk about a little bit of the research behind this concept, there was a small study that was done in a small population of older adults. I think the average age was 75, and they measured actual improvements in leg pressing power and thigh muscle cross-sectional area when they examined it on scans pre and post intervention. So the intervention group participated in 2 5-minute bouts of exercise a day, and then both groups ate a yogurt each morning. So that was just kind of a control they used, and also something that helps people get a little bit of protein in when they were adding this exercise intervention. This is so encouraging, and it really should be encouraging to you as well. That's 10 minutes a day, and it changed their actual muscle cross-sectional area in the thighs. And the thighs are so important to your ability to get up from a chair, to walk safely, and those are really, like I call them, metabolically expensive muscles. So the minute you are sick or have surgery and you're down for a period of time, those muscles in the thigh are kind of the first to really get weaker because your body just doesn't want to give them the nutrients they need if you're not using those power muscles. So those can be affected by even a short-term period of immobility. But thinking about that 28-day study and 10 minutes a day of exercise, I think you can find 10 minutes a day. And that was in a very small group, but there are other studies in other populations that show that these exercise snacks or short duration exercise can have long-term benefits. So in conclusion for today, kind of that quick tip. So 5 minutes. Think about 5 minutes. Where in your day can you add 5 minutes of exercise? And try for twice a day is your eventual goal. And then think about different exercises you can do. So you really don't need equipment for this. It's more about body weight exercises, and you can either look some up or think about just some things you've done before, like wall push-ups or sit to stands from the chair. That one I highly recommend. Standing heel raises, mini lunges or squats, doing maybe a little barbell press overhead. So yeah, you can pick up some small items in your house. I have people use like cans of food or bottles of water to do like overhead presses or bicep curls. So start small. So pick 2 or 3 of those exercises that are going to work some big muscle groups and be impactful, and perform them for 1 minute each. And then write down the number of repetitions you were able to complete. So say, I'm going to stand up from this chair for 1 minute straight. Set a timer, count the number, and write that down. And then you're going to add 5, you're going to try for 5 exercises at 1 minute each. And then you're going to be able to track how many you did in that minute. So you're going to start to see that progress. Maybe the first time you try it, you can only stand up from the chair twice and you need a rest break, and then you do 1 more and that's within the minute. That's fine. That's a great starting place, and you're really going to see the changes when you practice it over time. So that's my encouragement for today on Fitness Friday.
Thank you for joining me today, and remember to send any questions you have to Christine@agingwithability.com or comment on the website page associated with this podcast episode or on Facebook or other social media resources. Thanks again. Have a good day. Stay healthy.